Welcome back to BRMC's Healthy Connections. I'm Donna McMullen, your host today, with very special guests, Dr. Matt Wilson and Mr. Mike Beam from Human Motion Institute.
Wow.
Welcome. We're so glad you could join us today.
Thank you. For having us.
And Dr. Wilson, I'm going to start with you this afternoon, if I may.
Okay.
Can you tell us a little bit about the term interventional radiology? What is that all about?
Yeah, it's kind of a mouthful, isn't it? And I've been accused of being an international radiologist in the past.
Well, you know, a little travel and a passport, you're good to go.
Yeah, it's kind of double not seven, that's right. Yeah. But what that is about is using radiology technology to guide you in procedures. So for instance, you could use an X-ray machine or a CT scan to guide a catheter or a needle into a patient and do a procedure. And in general, if you're able to do something that way, you can get the procedure done more quickly and with less pain to the patient, basically. It's less invasive way to treat things. Mm-hmm. You know, micro-invasive is another way to put it.
What kind of procedures would you be doing?
Well, there are a number of different things. One that we do a lot around here is to treat people that have a fracture in their back. And we can take a couple of needles and use an X-ray machine to guide the needles right down into the fracture and inject some cement into it.
Oh my goodness.
Yeah, and that it's
awesome.
it's pretty quick. It's not a big long procedure at all, and people find that when they wake up, the pain is better.
Wow.
And that's something that there really wasn't a good treatment for that problem at all before that. It was pretty much just, you know, take pain pills and wait for the pain to get better.
Hope that it would get better.
Right.
Sure.
So that's something where interventional radiology has provided something that's where before there was not really a good solution. There are other things that we can do where it's sort of an advantage over the old way of doing things. Like for instance, if somebody has a blocked artery in their leg,
Mm-hmm.
Now we can go in there with a catheter and open up the artery and maybe blow up a balloon inside the artery and maybe put a stent in there to hold it open just through a catheter, whereas in the old days it would require a surgery, a bypass surgery that's you know, a much bigger deal for the patient.
I think you brought a sample with you today.
Yeah, I brought
we were
a couple of
talking
samples.
about this earlier
Yeah.
during the break.
Yeah, let me show you this one if we can get that on there. This is, I'll talk about that. The procedure where somebody has a fracture in their back. This is a model of a vertebral body, which is the bone in the back. And you know, these bones are stacked up like blocks, one on top of the other. And sometimes this bone will collapse and it'll be a fracture. And that happens usually in the older generation, people whose bones are starting to get weak. It might be from a fall or something like that. But what we can do is we can use an X-ray machine to help us guide a catheter or a needle into the bone. And we hold it this way, you can see that we can just go right down through the bone this way and another one over this way. And then we can inflate some balloons inside the bone, which will make a pocket. And then we take the balloon down and that leaves the needle still in place, and then inject some cement through each needle, and it fills the bone in with cement. And we can watch under X-ray because we've got the cement mixed with something that we can see on X-ray, and we can see it from the side and we can see it from the back, and we watch that cement fill in there, and once it's all filled in, we just take the needles out and we let the cement set up for about 10 minutes.
Oh my goodness, this is
And there you
truly
go.
amazing. This is technology at its best.
Technology, yeah. Interventional radiology is really based on technology. There's always new things coming out that we're going to be able to treat, hopefully. And this is one thing that has really been helping our patients in this area. A lot of people may be laid up in bed with a fracture and they can't even get out of bed. But after we put this cement in there, they can get up and go home.
Will this last for the person's lifetime?
Yeah, it's
hopefully.
Hopefully, we've not seen any problems with this cement on a long-term basis with this procedure. It's the same kind of cement that the orthopedic surgeons have been using for 30 years when they put in a hip or a knee. So it's got a long track record. In general, though, we do try to hold off on putting this cement in a very young person that has a fracture. Right now it's mostly for older people, and that's partly because we're not positive what's going to happen to it long term, but so far it's worked very well.
I'm almost afraid to ask what you define as older people going, I think I'm about ready. There's
You're
a
not
few,
there.
Yeah, I'm not there, thank you. Getting closer though every day.
Well, I think old sometimes refers more to your ability and function than it does your
that's
your
true.
number of years.
That's true.
At least as I get older, I begin to hope that's true.
Yeah.
That's definitely true.
Well, I see that you've also brought here with you. Would this process work any place on the spine?
Yeah, it would. In most people who have a fracture in their back from weak bones, it's in the lower back, which is the lumbar spine, which is the last 5 bones or so here. We also will do that in the thoracic spine, which is the ones that have ribs coming off of them up through here. The cervical spine up in the neck, it can be done. It's been described. We don't really do it that often around here. It's mainly perhaps for people with tumors in their back, in their spine, where it's done in the neck. But you could theoretically do it at just about any level. Most of them, though, end up being in the lumbar spine along and through here. And it's, well, you've got a number of things that can cause pain in the back. And this is for acute fractures. It doesn't really work for people that have an old fracture. It has to be a new fracture that hasn't healed. And I've had some people come up to me and say, well, I had a fracture several years ago, and would that work for me? And the answer is no. It's going to be pretty much healed up usually after a couple months. Occasionally there'll be somebody that has a fracture that doesn't heal up after a year, and we might be able to help them. But usually if we do an MRI, we can tell if it's healed or not.
So with a new fracture, and as a complete layman on this, and for our viewing audience so that they perhaps can understand more clearly then, with a new fracture, you need the fracture to be new so the cement will fill in? Am I,
well,
am I grasping that correctly?
Sort of. I mean, you could do a vertebroplasty on an old healed fracture, but it's, if somebody's having pain and they have an old fracture that's healed up, it's not from the collapsed bone itself that's causing the pain. It's going to be from something else. Sometimes, when you have a fracture, you get more bent over like that, and that may be causing the person's pain, or maybe the disc above or below is causing the pain. But usually, once your fracture is healed up, it's not going to hurt anymore, so there's no reason to put the cement in there. It kind of brings up the question of how does the cement help the pain? And we don't know for sure, but we think that it's maybe a couple of different things. Part of it is probably the cement holds the fracture steady, like you might imagine, so that it's not moving when you move.
So you don't have the friction.
Right, and the other thing is that the cement, when it sets up, it gets kind of hot, and they think that heat kills the nerves somewhat.
Oh, really?
And decreases the pain. So we think it's the combination of those two things, and that's because sometimes you can get real good pain relief, and you've only put in a little bit of cement, and that there's still some fracture that didn't get any cement into it, but their pain is a whole lot better, and that's why we think that the heat may have something to do with it as well.
And kill those nerves.
Right.
All of this is just fascinating beyond belief, and I know as I age, I want to know more and more.
Right. Well, that also brings up the point to say that people need to be aware of their bone strength. Anybody over the age of about 50 or so probably ought to be taking calcium to help build their bone strength up. Check with your doctor, and they can do a test called a bone mineral density study, which will give you a number to tell you how strong your bones are. And if it's low, then you can add calcium, and usually with vitamin D, and then there's some other things you can add on there. but also staying active is very important.
Very important.
You know, getting out and taking a good, nice, long walk is one of the best things you can do to help keep your bone strength up. And it's good for your bones. Not only that, it's good for your heart and your brain and your muscles and everything else.
Clears your head at the end of the day.
That's right.
We're going to take a short break, be right back, all right, and continue on with what we can do to stay healthy.